Well, Catherine Bardier is back in studio from the London Hospital. How are you?
Good morning. Thanks for having me.
Appreciate
I'm great.
you popping in.
Oh, no problem.
Things good?
Yes. Busy.
That's
as
good.
you can imagine, and hospital is just jamming with everything going on, obviously, with COVID and just busy in general.
Mm-hmm.
Yeah, so we have a lot going on in the community.
So I'd say, so my daughter goes to Richards.
Yes.
And there's been confirmed cases of COVID in the school, which many obvious schools are going through this right now. So I called the hospital yesterday and talked to one of the COVID staff and was like, what do we do? And walked me through everything. It was awesome. It was Carrie, and she explained everything and, watched for symptoms. And I said, the school has said the last confirmed case was on this day. And she's like, you're probably
out of the window.
Fine.
Yeah.
You're statistically, you're fine, but just keep, eye on everything. So it's a good resource to have.
Wonderful. Yeah. I mean, there's a lot of things you can do. One is to get vaccinated.
That's true.
Wear your mask and social distance. And it's, right now, there's clinics everywhere for this. Both the state, Greater Sullivan Strong, as well as the hospital, are offering these COVID vaccines. So that's probably your best bet right now. And I'm so happy that they were able to assist you.
Yeah. So you guys are doing flu clinics and vaccination clinics too?
We are. So first of all, Greater Sullivan Strong is our community public health network. And they're offering many COVID clinics. Tuesday, September 28th, they have one at River Valley Community College from 10 to 12.
Okay.
So that's a community clinic. They're also offering a community COVID and adult flu clinic. So it's both. And that's going to happen Friday, October 1 from 4 to 6 p.m. at Kearsarge Regional Middle School in Sutton.
Okay.
So that's a combination clinic. And I think you're going to see a lot of that this fall.
Yes.
Both with the flu and the COVID vaccines.
Yep. Now, have you got your flu shot yet?
I was scheduled this week, and unfortunately, I didn't make it, but I'll be going next week for sure.
Yeah, I got to get mine scheduled.
Yeah.
They were doing one at the rec center yesterday, and I just didn't have time.
I saw that. So I think, what's great is in the community, there's a lot of availability for these clinics, and so there's really no excuse. Get your flu shot, get your COVID shot, and we'll head into the fall on the right foot.
Oh, yeah. Especially, I understand that the COVID shot, there is disagreements on all that stuff, and people can take whatever side they want. I'm not here to preach either way. The flu shot is a tested, proven thing, and if you don't want to deal with people thinking you've got COVID, and also you just don't want to get sick from the flu, get your flu shot.
Exactly.
That's my opinion. I mean, I've said it before. I never used to get the flu shot. Then I got the flu, and it was horrible. And I'm like, I don't want that again, so I get the flu shot. Do it
every year.
Yeah.
Yes. So we definitely recommend both, and there's lots of availability in the community. If you are a New London Hospital and Newport Health Center patient, certainly give us a call, and we'll set up a time for you to come in. We are going to be doing a drive-through clinic in New London, in the front parking lot, and that will be going up on our Facebook page. It will happen in the next few weeks and also in October. So really easy. If you're a patient, you just call, schedule an appointment, and you'll be able to go right through the drive-through.
Excellent. Is that
which is super easy?
COVID drive-through, or is that flu shot?
Flu shots.
Really? Okay.
Yes.
Awesome.
Yes. So I think give us a call.
Yeah.
Definitely. The other thing we have going on is diabetes prevention.
Yes.
And we've talked about this in the past. We offer a diabetes prevention program. It is a CDC curriculum. It's a year-long program, so there's definitely a commitment. And it is free.
Okay.
And it's virtual.
Okay.
And things to think about. We've talked about this in the past. If you are pre-diabetic, you've been told you're pre-diabetic, you certainly qualify. There's also some questions on our website. Check out that pre-diabetes quiz.
Yeah.
We've talked about these high-risk factors in the past. You are at high risk because you're a man.
I know. That's so sexist of diabetes.
I know, huh?
So statistically speaking, men have the better chance of getting diabetes.
They do. And your age, of course.
Okay.
Higher risk as you get older. Certainly if you're over 50, if you're over 60, on the quiz, you'll get an extra point or two. Also, if you have, during pregnancy, been told you had gestational diabetes, that's a high risk.
Oh, okay.
If you have family history, so my nephew, my mother, my grandfather all had diabetes. So obviously I'm at higher risk because of that. Are you physically active? Or are you a couch potato? And also your weight category, your BMI, et cetera, those put you at higher risk. So check out that prediabetes risk test. And if you feel you're at risk, certainly go to the informational session. The first session is Wednesday, September 29th. It's being held from 10 to 11. You can register, or excuse me, this time we're not doing registrations. There's a Zoom link on our website, or you can reach out to me anytime, and we'll get you the link. But it's a free program. It's year-long. In the beginning, it's weekly. Then it'll go to biweekly and monthly. And you'll get a lot out of the course.
So is this for pre-diabetes?
It is.
So if you're actually diagnosed with diabetes,
exactly,
don't take it, or could you still take it?
No, you wouldn't be eligible. It's only it's a prevention program.
Okay.
So diabetes prevention program, we're looking at things like diet, exercise, and they take them through all of those throughout the modules. And one big risk factor, if your BMI is over 25, that's another risk factor, or 23 for Asian Americans, which is interesting, yes. So it's similar to the male-female.
Yeah.
Asian Americans tend to be at higher risk as well.
Crazy.
I know. So, again, go out to our website, check out the information. If you feel you're at higher risk, or you have questions, give us a call and we can help you walk through that. Come to the informational session and we'll sign you up.
So this is absolutely free.
Yes.
And it's, like I said, a year-long commitment.
And virtual.
And virtual, too. And is it going to stay virtual all?
It's hard to say. We thought a year ago when we were in the middle of this that we would move to in-person, which obviously in this situation is much better. You have the peer support, you're in person. We were providing healthy snacks during the session, which people loved, and they'd get the recipes. Unfortunately, we're in a virtual world right now, and it's unfortunate. But it could be that halfway through it turns to hybrid or in person, but certainly in the beginning it will be virtual.
Okay.
Yes.
But again, was it newlondonhospital.org is the website?
newlondonhospital.org. And then there is a tab at the top for community events and trainings, education. Go right out there and check it out. As you know, we always offer healthy conversations as well. Those are posted there. Our healthy conversations are every month. We just had one this past Monday that was really well attended. I was so happy. It's Recovery Month.
Oh, yeah.
And we had Ryan Fowler from the HIV/HCV Center in Claremont to talk about recovery-friendly communities and harm reduction techniques, trying to reduce the stigma, getting folks the help they need, connection to the resources. He is a prior IV drug user.
Okay.
And so he has a different voice. If you ever have a chance to listen to him, it's amazing because, you really hear the struggle and what worked for him. And it started in his teenage years. And those are the things that obviously we were just talking about this as parents. You worry about your kids all the time. And certainly those risks that come up through school, through friends, et cetera. So, there's a lot we can do as a community to make it recovery friendly, but also to help those kids make the right choices.
And when you and I grew up versus the kids nowadays, there's so much more influences.
Oh, my gosh.
We had to worry about a note getting passed around. And now it's social media and texting and Snapchat.
I forgot about the little paper notes.
Yeah, and that was it. Hopefully the teacher grabbed it and you don't get in trouble.
But now we deal with social media, the texting, and one thing obviously that we didn't have was the vaping.
Oh, yes.
And the kiddos and how easy it is for them to hide those devices and how addicting it is. So again, there are resources in the community. We in the region, part of the Greater Sullivan County Public Health Network, do have a substance use group that is all about prevention in our community. So if anyone's interested in joining any of those coalitions, on the Claremont, Sullivan County side, Newport side, we have Youth Can, which is a wonderful coalition. And then on the Merrimack County side, New London, Kearsarge, Sunapee areas, we have a coalition called Compass.
Okay.
So if anyone in the community is interested about more information around prevention, we make presentations. We're at the schools with the social workers and the nurses, trying to work through the navigation of that whole system and helping parents.
Yeah. The tough thing is just how much that vaping stuff is targeted and marketed towards kids.
Yes.
Though they say they're not. Oh, no, we're going for 21-year-olds. That's baloney. That is absolute baloney.
I couldn't agree with you.
You don't
more.
make Fruity Pebbles flavored vape.
Yes.
For a 21-year-old.
Yeah, it's the flavorings.
You make it a 13-year-old.
That's right.
You're targeting a kid.
And I know there's a lot of advocacy work going on and some legislation around this, both nationally and in the state. But I think we there's definitely room for improvement around that. And the flavors, obviously, they're not targeting 30-year-olds.
No.
They're definitely, cotton candy is an attraction to the teenagers. And and I think what scares me the most, there's a lot of unknown about the chemicals in these vape products and how it's harming your body.
Yeah. It's a shame. I know it's an ongoing battle for Youth Can and for the hospitals and for all the coalitions, not just in New Hampshire, but all over the country. It's an epidemic everywhere.
Mm-hmm. Most definitely. I know. I know. So there's a lot we can do, and there's a lot happening in the community around prevention work, and so we'll keep plugging away. But if anyone's interested in learning more, joining the effort, please contact us and we'll get you connected. They can certainly go to the Greater Sullivan County Public Health Network website or New London Hospital and connect to me. Again, my number is 603-526-5093. Super easy. Give me a call and we can chat.
Perfect. Catherine, we'll talk to you next month.
Yes, most definitely.
Thanks for coming in.
Yes, thanks for having me.